Okay, so special day today for Flex. It's Flex Institute. And a matter of fact, if I remember now, the other day I actually went there and we talked a little bit about the place to be with Patrick D and why they changed the name and what exactly they offer. But today was a big day. They had their ribbon cutting ceremony. But let's learn a little bit more about Flex. Hey everybody, the place to be with Patrick D today. We are here at the Flex Institute. It actually went by a different name that some of you might be familiar with. So Dr. Cox, again, let's remind people, Flex Institute was formerly known as
Orthopedic Specialist or Musculoskeletal Institute of Louisiana.
Flex is a lot easier to say.
It is. That was part of the thing too. It's a mouthful to say it in the other two.
But it actually serves a purpose in a way because you all are addressing people and their flexibility.
Exactly right. I mean, we tried to look at what are we trying to accomplish here. We're trying to make people more flexible, make them mobile in life. And I feel like as we talked about it, the old name didn't really fit that. Didn't fit our goals, fit our mission. And the mission is to make people more functional, pain-free, and to go enjoy and live life as they want to.
Now, you just made a comment. I want to segue into my next question for you. You're talking about individuals. So your approach, how's your approach to individuals to make sure you have something specific for them?
Yeah, I think part of it is when you're evaluating, examining a patient is sit down and talk to them and really listen to what they're saying, because everybody has individual issues. I mean, they may all have a bunion, but they have certain situations at home that may change their ability to recover or come into with certain limitations that you have to address going forward or as they recover from any kind of treatment. So taking the time to really understand their situation outside of their orthopedic problem.
Let's talk a little bit about this, something approach you all have too. We've heard of, if we get sick sometimes, we go to a quick care.
Exactly.
So you all have your own, I guess I must say, version of quick care. Just tell me a little bit about that.
Yeah, we have the Flex Urgent Care, and it's designed to specifically for orthopedic problems. That if you are at home, sprain your ankle, fall down, feel like you have some orthopedic injury, you can call us and we will see you that day, as you would in urgent care. The advantage to that is you're seeing an orthopedic specialist that day. You're not having to go to an ER or an urgent care that then refers you to an orthopedist. We're able to get you in a treatment protocol, hopefully lessen the time for your recovery, speed up, decrease in pain, discomfort, and return to function.
Okay, let's wrap it up. One final question for you. If somebody wants to take advantage of the quick care aspect, is that something to call you all on, or they show up, or just show up instantly?
Kind of either way. I mean, you can call, if you call, you may be able to set a better time that works for you. I mean, if you are out in this area and don't have a phone, which is hard to do these days, but you come in, you walk in, or go on the website, and there's available to look on the website to find schedule an appointment to see us there.
Gotcha. Dr. Great information there as well. Again, everybody, don't forget, they've renamed it. It's now called the Flex Institute, and it's the place to be with Patrick D. Well, today turned out to be a day with a little bit of morning rain, but also it's also a special day for one place. It happens to be a place called Flex. That's right, Flex. They actually deal with as far as, orthopedics. Matter of fact, it used to have a different name. So today was the ribbon cutting, and a matter of fact, the place to be with Patrick D. We share more about what the place is all about. Hey everybody, the place to be with Patrick D. We're at a place that's had a recent name change. It's now called the Flex Institute.
That's right.
And I actually have Dr. Pearson here with me now. But Dr. Pearson, fill me in. This actually wasn't always called the Flex Institute. What was it called before?
Beforehand, we were Orthopedic Specialists of Louisiana.
So why the name change?
Kind of a modernization of our brand. We want to kind of express to the community this new mindset of motion, getting back to the things you used to do, and really this whole movement and lifestyle kind of brand push. We're trying to update and modernize our brand.
So I guess flex almost being flexibility there.
Flexibility.
Yeah,
That's
okay.
Right.
So, but other than that, though, a lot of the stuff has stayed the same as well for you guys.
Right. Same great people, same staff. We're just kind of updating our brand a little bit.
Okay. So let's talk a little bit about you yourself. What is your specialty?
So I specialize mostly in anterior hip replacement, knee replacement, and also do some shoulder replacements.
Okay, shoulder replacements. So, I guess too, my other question I have for you, we think a lot about these type of things you deal with, maybe in some that might be the older generation, but I guess you see folks of all age groups.
Sure, yeah. We see people I saw a 13-year-old boy today with knee pain from a football injury, and I saw a 92-year-old lady yesterday. It's all gamuts.
Okay, I'm sure you've ever had a frozen shoulder.
Of course.
Okay, my wife's had that before too. Very painful. She'll let me know about it too. So let's talk a little bit about the technology.
Sure.
What's available now when it comes to technology? I know you'll have a special type of robotic. Is it Mako?
Yeah. So the Mako robot is an awesome product that we have, and really it helps us to put the implants in with a lot higher precision and accuracy than we could years ago. And so it really helps us with our accuracy on putting those parts in just how we want them. And we are able to use planning before surgery to execute the plan to perfection during surgery.
And I'm making a wild guess here. This perhaps speeds up the overall process, maybe speeds up perhaps the recovery,
Sure.
and helps out the patient.
Certainly, there's some studies that show that it can help recovery in some instances and kind of speed things up.
Okay. I'm sure folks can learn more about you all, pick up the phone, go online, and all that kind of stuff as well.
Certainly, you can go onto our website or pick up the phone. We're here to see you any day, all day long.
Okay, Dr. Pearson, we appreciate it very much. The place to be with Patrick D right here today, Flex Institute, new name for you right here in Shreveport. That's a look at your weather forecast for you. Today was a special day for Flex Institute, a ribbon cutting ceremony. Now, Flex actually used to go by a different name. So that's the subject of today's Place to Be with Patrick D to learn what it's all about. Hey everybody, the Place to Be with Patrick D. We are right here at a place now called the Flex Institute. Got that right?
Yes, sir.
Okay. It was formerly called what?
Musculoskeletal Institute of Louisiana.
Okay, Flex is a whole lot easier to say.
Yes, it is. That's why we decided to do that.
And I think, too, it's all about as well, what you're really trying to work with people on their flexibility and
That's
make
right.
it better, too.
That's right. That's right. We're trying to improve people's mobility.
Yeah.
Right? Specifically me, since I do hip and knee replacement. And flex is not only just a play on words, right? It's also just our, reiterating our importance to people to maintain their mobility, to get up and move, and to flex their joints, right?
So obviously, too, folks, this is Dr. Lebrano. You've
how are you?
been doing this for how long?
About 8 years.
About 8 years doing it. And you said your specialty was?
It's adult reconstruction,
Yeah.
but I specialize in hip and knee replacement and revision surgery.
Okay, so I'm not giving any names away, but I work with somebody that talks about hip replacement. Is that something that you do, but you may have to do again in your life? I'm just curious.
Yes, usually they last about 20 years, and then sometimes the head and liner portion, the plastic piece, can wear out, and if that's the case, then we can go in there and change those pieces out if need be.
Normally this is something targeted more towards an older demographic, or are you seeing people of a variety of ages?
It's actually a good question.
Yeah.
Used to be an older demographic. However, the parts that we now manufacture and are made have such a good record and last so long that we're actually putting joints in on younger people. There's been people that have been in their 20s that I've done total joint replacement for because this plastic is now lasting 20 plus years.
Yeah.
So it used to be that when you were 50 and you had a bad joint, we would tell you, sorry, man, wait
Right.
for another 10 to 15
Exactly.
years. But now we're actually putting them in and people are able to get on with their life and kind of maintain their mobility and do what they want to do.
Let me ask you this question. So we're getting towards that time of the year, the end of the year. People think, should I get it done, not get it done? What could be the best option for them, especially considering maybe their insurance and out of pocket and stuff?
That's a very good question. So as far as timing goes, I know for joint replacement that specifically the end of the year is really the big push, mainly because people have met all their deductibles with their insurance and things like that. So really in the October, November, December range, they're really trying to go ahead and get their joint done so that they can, since they've met all their deductibles, right? So that's kind of the busier time. So I'd say go for it if and act now.
Exactly. So again, great advice there. Dr. Lebrano joining us here today. Get in touch with him. And remember, if you're going to look them up, it's now called the Flex Institute. So come see him. It's the place to be with Patrick D today.